This is just a fascinating time. The things that we're able to do with the technology at our fingertips is amazing. And every day we are looking at ways and finding ways to integrate that for the benefit of our clients.
Many of our campaigns that we're launching in different languages, we engage in research, focus groups, testing. This is the real deal. It's real insight, it's real impact, it's real results, it's real connection with these audiences of different cultures.
Hello and welcome to the MM+M Agency 100 podcast brought to you by Maricich Health. I'm Bella Chakowski. I'm a reporter here at MM+M, and for today's conversation, we're talking about the evolution of healthcare and pharma marketing and the growing importance of multicultural engagement with the agency celebrating 40 years in business. I'm pleased to be joined by Mark Maricich, who's the CEO, and David Maricich, who's the President and Chief Creative Officer. How's it going today, guys?
It's going great. Hi, Bella.
Well, let me ask the question off the top that's on everyone's mind. Obviously, I just said Maricich a bunch of times. You share the last name, you share the business name. The assumption is that you're related. Tell us about that relationship, how you work together, and how that dynamic has sort of shaped the agency over the years.
Yeah, well, thanks, Bella. It's really interesting, actually. We're on our 40 years here, 40th anniversary of Maricich Health. And it really goes back to a family enterprise that Mark and I originally weren't involved in. In early days, we both went into entertainment in LA, worked with various clients, but found a calling back to the agency and healthcare in general. And it's been now 25 plus years of working on a variety of healthcare and life sciences clients across the country and internationally as well. But the early days, the agency was started by our mother, Suzanne, and we were one of the first agencies. And actually, her story goes back even before that. She was one of the first females in the boardrooms in hospitals and health systems and launched the first ever advertising campaign on the West Coast for a hospital. And that was for the St. Mary Medical Center in Long Beach, California. And from there, went on and worked at other hospitals and then started the agency in 86. And as I mentioned, Mark and I, we were off doing, Mark worked in TV and film. He was actually an extra, I think, in, was it Matlock or one of those Texas Hunter, Texas Ranger? I don't know. And I was off doing the music business, working as a talent scout, working with bands like Tool and Matthew Sweet. But in the late 90s, early 2000s, we and Mark had worked with other advertising agencies as well. And I had worked in marketing positions in the music business as well. So we just connected the dots and started working together and took what was really a healthcare publishing company at the time and turned it into an integrated branding and marketing agency focused solely on healthcare. That was in the early 2000s, and worked on a variety of accounts over the years, and we got to work in the family dynamic, and Mark can speak to it as well. But the beauty of starting an agency as a family is you can be really honest with one another and also be very, not only just on the business, but also the client work. And Mark and I have had very spirited conversations over the years, but it's always led to just better output, better product for the client and outcomes. It's been a fun journey, an interesting journey, a family journey. And Mark and I took over, really running the agency more than 10 years ago. I think it was like 12 years ago that our mom retired. She unfortunately passed away a couple of years ago, but was always involved and loved to come in for parties and things. But allowed us to really continue to grow the agency and move into different areas of specialty. Mark, why don't you fill in on my rambles?
Yeah, well, I was an extra a couple times, but mostly worked in TV film, got my degree in TV film, worked for a number of different production companies. First started out doing industrial films, but then actually got into feature films, eventually working as a grip And then and also leading and working at a television station in Vail, Colorado, producing local TV spots. But ultimately, the grip part of my career came to an end. I just kind of got stuck on a circuit of really bad werewolf movies and films. I worked on a film in the desert called Motor Psycho for about a month with a guy driving around the desert on a motorcycle. And so ultimately got into the agency business, working at some other agencies, working a lot in healthcare, but also a lot of B2B consumer brands and working on that. So that was really the background, is really that working hands-on at different agencies, and then also having that wealth of all that experience in the film production background. So that's a little bit of that background there.
Interesting tidbit with our family connection to this business is actually goes way back, going back to a fishing heritage of Croatian fishermen. And our great-grandfather and even beyond were fishermen in Croatia. Our grandfather immigrated here in the early 1900s and resettled in the Pacific Northwest, worked in on fishing boats in Puget Sound and in Alaska. So Mark, there was a family tradition of sending the boys when they were 14 or 15 years old up to Alaska to become men and learn a work ethic. And so Mark went up first. He was 15 years old, and 6 years later, I then went up. We both fished in Kodiak, Alaska. Mark did a stint in Southeast Alaska fishing for salmon and some other fisheries as well, halibut. And really on the grounds of the deadliest catch fishermen, we were there in the summer times, but saw a lot of stormy weather and a lot of long days of hard work. And so that was really translated into our culture of rolling up our sleeves. And, we're right there embedded with our team working on projects. And in this business, sometimes you have to, put the time in and get it done for your clients. And, it's just our second nature to us, because that's how we grew up with this work ethic in this Croatian fishing family. Going back to really our formative years. So, yeah, it carries through to today.
Interestingly, a little bit of the analogy that I use with that was when we were commercial fishermen up in Alaska, we were casting our net out and we were catching fish to really feed the world. And, since that time, us running an agency, we're still casting out our net, but we're also casting it out to people and to helping them gain access to healthcare. And so in a sense, we always had a purpose. And, back in the days we were feeding the world. Now our purpose is really helping to benefit the masses by providing access to care, access to some of the greatest technologies and treatments for care. And so it's always been a purpose-driven approach to life. Dave and I have had, and again, it's really about trying to connect with the people, on a larger scale.
Absolutely. And, maybe you guys better than anyone or most folks in the agency landscape, having had this business in the family for 4 decades now, can probably speak to, trends. I feel like we're talking now about AI and how much it's disrupting, shaking up the industry. But looking even further back than that, like, when you look over, the past 40 years or whatever, what are some of the biggest changes or trends in healthcare, pharma, and marketing and communications that you think sort of underlie that work?
Yeah. Well, we always say that in healthcare marketing, the greatest constant is change. It's always changing and it always has. But really go back those 4 decades. I mean, one of the biggest changes was that people actually started marketing. I mean, back in the day, there was never an ad for a hospital or a doctor or pharma. I mean, there was no marketing whatsoever. And as Dave mentioned, our mother, Suzanne Maricich, she was one of the trailblazers. I mean, she literally launched what was some consider as one of the very first ads for any hospital ever of all time. And we actually have some of those ads here in the office. They're pretty amazing looking, But yeah, people were, people actually started marketing. That was the biggest change. Then you had the late 90s with pharma ads, is that they allowed for adequate provisions versus the full prescribing information. So that was really the beginning of the pharma advertising that you see today, the ability to advertise without having to list tons and tons of information. Then in the mid 2000s, what happened was a change. You started to see the first significant provider branding campaign. So Kaiser Permanente, Thrive. I remember still being in a meeting with a health system doctor, and he said, "Did you see that ad on TV? That ad, that Thrive?" And I said, "Yeah, we saw that." He goes, "I want to be like that." And that started a shift for hospitals and health systems to really dedicate their efforts to really creating brands. And then, of course, then in the early 2010s, you had the Affordable Care Act, opening up all this access to care never seen before, and the expansion of Medicaid for audience as well. But then, with this evolving, changing political climate that just seems to change on an annual or every couple years, we're always addressing this, and really, again, that constant is change. And then, of course, Bella, as you mentioned, all the technology and the digital media and the social media, the ability to reach people where they live, work, and play, and all the AI tools, which I know is a topic we may be discussing here as well. But all of that, really allows us to scale at a greater pace with all this richness of data. And then on top of that, what has also changed is there are a heck of a lot more healthcare marketing agencies than there even were just 10 years ago. We were among the first to really claim that position. And people are joining that space, but where we really differentiate is this great experience in this integrated healthcare ecosystem. And, one of the greatest things that we bring, which is also one of the biggest changes, has really been by the recognition of clients and other marketers with really truly connecting with multicultural audiences and communicating with them in ways that best resonate with them in the communities that we all serve. So I would say that was a pretty good summary of some of the biggest changes.
Now here we are in the age of AI, and every day it is on the topic of everyone's meetings. It's what we're thinking about. It's what we're experimenting with, and it's what we're actually executing and implementing for clients, and all of the questions that go around it. I have a saying, and they made me a T-shirt. I said, "My life is not boring." And they, for Christmas, they made me a T-shirt because, this is just a fascinating time. That's what it can be daunting, but the things that we're able to do with the technology at our fingertips is amazing. And every day we are looking at ways and finding ways to integrate that for the benefit of our clients. And I'll just give you a couple of examples. We had a client that we didn't think was going to be very interested in AI, and we thought they'd be more conservative. And we found that they were actually experimenting, on the client side themselves. So once we learned that, we said, "Oh, well, let's see what we can do." Budgets were a little bit tighter, and we were really able to supplement video in a creative sense that really enhanced and allowed us to tell a better story. And, that was the key. And that's what we said from the beginning. We're not going to use any of the AI technology unless it really enhances the storytelling and it's not distracting. You're not going, "Oh, look at that fake AI thing." It's like, no, it helps. And we're doing it with mixed media as well. Like, we're really bringing in, actual footage and being able to use that to train to do other scenes and enhance things, so that when you get to the end of it, and the litmus test for us was, we showed it to a lot of people, some of the projects we were doing with AI, and of course the client and we had testing and things like that being done. But the litmus test was, we had a really great production crew and an extended team. And we kind of had a quiz, and we said, "Okay, show us the AI in this production." And no one could guess it right. They were actually guessing the opposite. They were guessing the actual footage is AI and the other is not, because it was so seamlessly integrated. So those are the things that are exciting. And, what can we do with that? What can we automate? But it's only good if we're telling an authentic story and it's reaching the audience in a way that affects their lives and enhances their, because they have access to information and they're acting on that information to find new treatments, to get access to care. So that's the litmus test for us ultimately. And we're seeing we have a campaign right now that has the AI, creative that was a hybrid. And we were finding higher engagement, and we're like, wow, because we told a better story with that AI. Mm-hmm. And so that's really a key for us. And again, we're every day, and we've got a great team of business affairs, legal, reviewing this. We're reviewing it with clients, and ultimately making sure that we're on the right side of the legal landscape and because it's changing daily, and what different platforms are offering, what protections they're offering. And every day there's a new model that does something. Even foreign models, Chinese models that people are playing with, but you have to be careful. So so we've got a great team, great production team, and that's really the future. Of course, I'm sure it's cliche. The future is AI, and I have a joke here in the agency. I say take AI and just change it with the internet. And if the client says, well, I'm really afraid of using AI, well, just put the internet and then go back to 1996 or 98 or whatever it was. Well, I'm afraid of using the internet. What's going to happen? Well, you look back at it and it sounds silly. And so it's the same thing. You got to ride the wave. I'm a surfer. I love to surf here in California, but around the world. And we were even talking about New York. There's good surf in New York, and you got to ride the wave of AI. Otherwise you're going to get buried by the whitewash. So that's our philosophy.
Yeah, I think that's a great way to put it. And I like what you said about a litmus test. It's interesting. I feel like even in the past year, like the image generation specifically in early days, like everything looked, kind of dreamy and cartoony, and like it couldn't really produce images that were so realistic and could be mistaken for multimedia, that could be mistaken for non-AI, and just how far those things have come.
There is a danger especially with testimonials, and you're seeing some of the shadier characters on the internet putting pre-roll video on YouTube, and it's clear that it's not a real person, and it's probably hailing from a foreign company trying to trick consumers. And obviously we don't support anything like that. But in the realm of storytelling, there's movie magic. You hire actors who aren't really patients. You use some, on tighter budgets, you might use stock footage. That footage might be shot completely in another country, but it might look like it's local. So, there was a storytelling aspect of production, even Photoshop, retouching, recreating photos out of multiple photos. There was all kinds of stuff going on behind the scenes, CGI. So AI is just the next phase in that if it's used properly, but it's so powerful that you have to be very careful that it's not misrepresenting the brand. And then again, with the legal landscape, there are laws in New York right now that require disclosure. Is that going to catch on to California or to nationally or even internationally? All these things are going to, every day there's going to be, you got to keep your news feed handy and see what's going on with that, because it's a constant state of change.
Yeah.
But it also, again, a fascinating and a very interesting, it keeps life very interesting and definitely not boring.
Yeah, definitely not boring. All right, Mark, you mentioned that you all have a multicultural expertise. It seems like that's certainly something that sets you apart in the agency landscape. Can you talk a little bit about how you came to focus on, bringing that multicultural element expertise to your work, and how that approach might have evolved?
Yeah, sure. I mean, living in Southern California, of course, multicultural communities, this is just part of how we grew up. And a little bit of the background too, our father is a professor, was a professor of organic chemistry. Basically, he had a lot of different students, a lot of different cultures. We were really grown up in that. And so that was always a foundation of everything that we were brought up with. And then you get into healthcare marketing, marketing for a lot of hospitals and health systems, especially in Southern California. And God, there are so many different communities we're trying to reach. And our agency was among the only ones that were really reaching out and communicating these campaigns in different languages. First started out in Spanish language advertising along with the English. And then we started getting into some of these campaigns in LA County, for instance, with the launch of the Affordable Care Act and some of the Covered California programs. And, really getting into launching campaigns in 10 plus threshold languages. So we're looking at English, Spanish, Korean, Vietnamese, Chinese, Tagalog, Farsi, Armenian, and more. And really building upon this expertise with a full range of creative directors and team members and strategists to reach these different audiences with authentic messages. And so it's really been a foundation of everything that we've done. And Dave is, as our creative director, he's in the trenches of this every day, leading our multicultural team. So Dave, why don't you give us a little bit of background with this as well?
Yeah. Funny thing is sometimes people go, how did two white guys, end up running this agency that has this depth of multicultural experience? And, I always laugh, and it's a legitimate question. As Mark mentioned, we have this history going back to a very diverse community in Southern California and our upbringing with, being around our parents in an academic setting, and they would bring so many different colleagues, of all different backgrounds, also LGBTQ as well. We grew up in a very inclusive household. So that was a starting point. And then we, of course, just exposed to language, learning different languages. I was actually in a quinceañera when I was 15 or 16 years old. So it just seemed this was just normal life. And when we got into healthcare, originally it was like, we could, we just had requests to do translation, but that quickly grew into a more sophisticated approach and, getting exposure to campaigns where we had to not just translate, but transcreate into 10 different languages for the launch of the Affordable Care Act, et cetera. And then that became our cultural infusion team. And what's really unique and different about cultural infusion is we do things cohesively, looking at the general market and multicultural audiences. And really, when we're developing campaigns, the team works together as an interdisciplinary team to develop core human truths that then can be cohesive. So if there's an in-language spot, and you have audiences now that are bicultural, so they're experiencing it in their language, but they might also be seeing a lot of English language ads, and then they're watching it with driving a grandparent to an appointment, and they're listening to Hispanic radio in Spanish. So you need that to be cohesive. So, and then the other aspect that's really fascinating is you have the acculturated audiences, like acculturated Hispanics who, they're mostly experiencing life in the general market in English, but they're very open to messages that weave in the culture. So so that's a big thing for us, is how can we weave in authentic messages in Spanish or other cultures into a general market campaign. So that's what we really do with cultural infusion at Maricich Health.
And just a little side note on this is it's not just like our cultural infusion team is just coming up with ideas that they feel will connect just based on a hunch. It really is based on insights and strategy. And many of our campaigns that we're launching in different languages, we engage in research, focus groups, testing. We just actually had some focus group testing last night for a campaign in Spanish, and just incredible insights that are gained from this. And this is the real deal. It's real insight, it's real impact, it's real results, it's real connection with these audiences of different cultures.
And we're doing this across multiple segments in healthcare: pharma and life sciences, health systems, payers, and other types of clients. So that's an exciting thing for us too, is the subspecialty we have. We've been able to really apply it to very many different areas across healthcare.
Yeah, I'd love to talk a little bit more about that. As opposed to an agency that works exclusively in pharma, you do pharma plus other aspects of healthcare. Can you talk a little bit about, what you see as an advantage of having a bit more of an array there?
Yeah, well, we are specialized in really this grand understanding of the integrated healthcare ecosystem, working across a lot of different categories within this ecosystem and understanding the different segments. So really what that brings, this perspective, is we're just really able to understand the big picture and really understand it and really connect the dots across the board and offer our clients solutions to reach their audiences, no matter who they are or where they are. So just to give a little bit of a background here, in this integrated healthcare ecosystem, we're working and targeting both consumers, so healthcare patients, also medical professionals and B2B. So it's a blend of B2B and consumer. And just the categories that we're reaching across the board include everything from, of course, pharma, life sciences, medical device, but also health systems. So that would be hospitals, that would be medical groups, payers, so all the different health plans that are out there. We work quite a bit in public health, and public health includes everything from health systems that are owned by public entities, but also different healthcare information campaigns that are out there, whether they be for different disease awareness or prevention. Also emerging healthcare categories, whether it be software or different services that are targeting healthcare players, whether it be health systems, whether it be rev cycle management across the board, and just really understanding how it all works together. And so, many times we're coming in at this high level consultant aspect. We're coming in at the brand. We're coming in for a new product launch. We're coming in for developing the overarching value proposition. We're conducting quite a bit of stakeholder research, whether it be internal stakeholders, C-suite, executive teams, sales teams, then going out to voice of customer, and even international. Many times we've actually developed value propositions and naming international, where we're actually having focus groups internationally, where we're on our, we're joining the meeting at 2 a.m. with audiences in Europe, across the board. And really having that great understanding. And then Dave, why don't you share a little bit about our expertise in pharma, going even beyond just the marketing and just really the understanding of just the nuts and bolts of the business and drug development?
Yeah. Well, we've always had the philosophy to be, we wanted to be agile. We wanted to be working on different things because we've to this day, and we think it gives us an advantage that we really have a 360-degree view on what's going on in the healthcare ecosystem. And so whatever we bring working on a particular segment in healthcare, whether it be life sciences or health systems, it gives us a really unique perspective. And it also has allowed us to be entrepreneurial as well. And so we had an opportunity in the beginning months of the pandemic. We had a small client that was preclinical stage, a life sciences company developing a treatment for Alzheimer's disease. And we were doing some baseline brand and investor relations work, and they were really not sure if they wanted to continue. And we just said, this is really important work. They had a differentiated approach focused on the inhibition of butyrylcholinesterase, an enzyme that's been overlooked. And we were fascinated by it. We said, this isn't too important to just let it go by the wayside. So Mark and I, we rolled up our sleeves. We got involved on so many levels of, not only, really getting the investor pitch together and things like that, but actually involved in the strategy for the company and the development and research, and really working with a group of phenomenal PhDs, exploring different indications and really just setting our strategy. We're involved in now AI, medchem development work, which is very exciting. So leading edge for life sciences, not only in marketing, but on the development side. So that's been really exciting. And it's just again, been a testament to our approach of really having a 360-degree view and going back to our early days on the fishing boat, rolling up our sleeves and, working with, some phenomenal PhDs and learning the science, learning the chemistry. And it's just been, phenomenal. And ultimately, our goal is to, every day is to try to give back so that patients, people and communities can have a better quality of life. And whether it's marketing, whether it's, helping to early stage companies, help them move their technologies forward, that's what we lean into every day. So it's very, it's been a great run, and we're on a mission to keep this going for years to come. We're just very excited, and every day to get up out of bed and do the work that we do, it's very satisfying and exciting.
Well, I think that's a great note to end on, or at least for the important part of our conversation. We are, though, asking agencies in our A100. The theme is video games this year. So curious if either of you are gamers and what your favorite games are, if so.
Well, that's funny because the team came up with a pretty cool concept that you can see when you look at the A100. But Mark, I think, introduced me to Pong in back in the 70s. Mark played Pong before I did, but I was quickly addicted to it. Moved on to Atari at the arcade and at the Tasty Freeze, where there was one Space Invaders machine that went on to asteroids, and you'd have to put your quarters up and the bully would come and take them down or throw them across the room. On to home Atari, Intellivision, Activision games, and then Nintendo. And then I kind of discovered other things and then, went on from there, but still have a love of video games, especially the early ones. Intellivision, the early Activision Atari games, Pitfall, Megalopolis, River Raid. I mean, you can't go wrong with those. I actually got patches from Activision after when I hit like 1 million points. So,
wow.
Yeah, right when our mom started the agency back in '86. I think I was just in college and barely, and she basically converted my bedroom into the new office. In the meantime, she took out all of our Atari games and donated them along with all our baseball cards and football cards and our classic Hobie Sundancer skateboard that's now in the Skateboarding Hall of Fame, worth I think $1,000. So anyways, yeah, our vintage Atari that was probably worth $10,000 nowadays is no longer, but hey, it all ended up good.
Well, gosh, I'm glad I asked. You guys do have quite the depth of gaming experience and history there. Well, look, thanks again so much for joining. I feel like this conversation has been really, really insightful, and hopefully folks can learn from your expertise and, decades in this work. Appreciate it.
Well, thanks, Bella. Appreciate you having us here on the MM+M podcast, and glad to have an opportunity to speak with you.
Likewise. Thank you, Bella. It's been great and really appreciate being on the podcast today.